Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Welcome back, everybody, to another episode of Keiser Voices. We are continuing our conversation regarding mental health awareness by trying to understand our emotions before they control us. I'm going to introduce you guys to our two special guests this week, and then they're going to give you a little bit of background regarding their practice, what areas they're specialized in before we get into our questions. So joining us is Dr. Jeffrey Rice and Dr. Francisco Gonzales. Gentlemen, thank you for joining us.
Thank you.
Thanks for having us.
So let's start with you, Dr. Gonzales. Can you tell us a little bit about your background in the industry?
Sure. So I'm located in Louisiana, one of the few in the program that's not in the Eastern time zone. But clinically, I have a background working in substance use treatment and school counseling and private practice, which is what I do nowadays, in addition to teaching. So in private practice, I see a lot of individuals, and my specialty often are teenagers and young adults who are going through life transitions, specifically within the neurodivergent community. So mostly those with ADHD, but we work on a lot of things like anxiety and other emotions. And I have a large male population too that I work with, and more so than not, it is about trying to recognize emotions, especially in Southern Louisiana, where emotions weren't necessarily the thing that you talked about at the dinner table.
Awesome. Thank you for sharing that. And Dr. Rice, a little bit about your background?
Oh, I am, let's see, I've worked in a lot of different environments, I guess. So I've worked in anything from inpatient, outpatient, substance use disorders, outpatient, dual diagnosis. But right now, I spend most of my time, I split between teaching and then working with first responders and veterans. So anybody who's exposed to chronic trauma or chronically stressful events, I spend most of my time working with them. So be it fire departments, police officers, things like that. And then, of course, obviously veterans. And actually, I have some people that are deployed right now that I still see through telehealth while they're deployed.
Amazing. Thank you. So I guess our first question should be, and I'm going to start with you, Dr. Rice, is how do we define emotions? Is it just internal? Is it just external? Right? I'm going for the hardest question right off the bat. But I think we need some kind of like a baseline of what we say when we're trying to talk about understanding our emotions.
Yeah. Wow. So emotions, I feel like let's start off with the tough one here.
Get it out of the way.
Right, exactly. So emotions really are their feelings, right? But they're also accompanied with some physiological symptoms, right? So when we think about we're going to use something like embarrassment, okay? Which, oftentimes people will find their face flushing or something like that. So it's not just I have this feeling, but there's also something else that comes along with it. And what we try to do is, one of the challenges is how do we measure these things, right? How do we measure these constructs? Because we know they exist. So if I say, hey, let's talk about your anxiety. Well, we all know anxiety exists, but how do we even begin to say, measure that? Because what might be a 6 on the we always come back to, hey, so on a scale of 0 to 10, with 0 being not no anxiety at all and 10 being the worst feeling in the world, where does your anxiety fall, right? And yet really that's not a very good method either, because for Heather, for you it might be something like it might be a 4, but for me it might be a 9. Right. And so it's one of those challenges that we have. But really, those are those things that, and if I kind of think about it like this, what happens is we experience something, right? We usually will tell ourselves a story about what we just experienced, and then we'll feel something based on that experience or based on that story that we tell ourselves. So I don't know if I got that or not, but
so I'm going to ask No, it's very abstract, and I think, but you have a good point though as to why, because it's very subjective, right?
Right.
Which was the point of it. Everybody interprets things differently, and will feel various layers of it. So I think it makes absolute good sense what you said. But Dr. Gonzales, with that, are emotions truly controllable?
Hmm. It's a great question. I always like to say sometimes they are and sometimes they aren't. But the main thing is when you say control, do you mean that you're able to get along with them or to, coexist, right? Because oftentimes we feel these intense emotions and they feel uncontrollable. And intense emotions often lead to intense decision making. So can we control emotions? We can definitely get ahead of them, through practices like mindfulness and getting used to naming and feeling emotions. So in my wonderful graduate school history, I'll give the answer of that's a gray area.
That's a great answer.
That's
So
awesome.
then, why do emotions sometimes take over our decisions? And oftentimes I think it happens before we even realize it. And does that tell us anything about how our mind is truly working?
Yeah. Would you like to
Yeah.
go, Dr. Rice?
Okay, I was like, it's up to you. Okay, so here's where this is where I kind of land is that, a lot of times, so there's different parts of our brain, right? We have kind of that what we call the neocortex, or right, where that's kind of that the logic and the math and this, problem solving, that kind of thing, right? But we also have what we call the limbic system, which is our like our habits, our emotions, that kind of thing, right? And so oftentimes, so here's kind of the way that I do it, which is this is my brain. I know it doesn't look like it looks like a hand, right? But this is my brain, right? So this is my neocortex here, right? This is my diencephalon, which connects my body to my movement and stuff like that, right? But then this is my brain, my limbic system, my habits, my emotions, my brainstem, right? So what happens is that if we start working out of that limbic system with the emotions, right, that's when people tend to flip their lid, right? And so what we try to do is I like how Dr. Gonzalez said it, is that it's not about controlling emotions as much as it is managing or being okay with them so that they're not running our lives, because we're always going to have them,
Mhm.
right? Like you can't get away from them.
So I guess that really then leads me to my second question, Dr. Gonzalez, and that is, how do we identify those hidden emotions before they start to influence? Or is that even such a thing? I mean,
Mhm.
are they really hidden? In my head right now, all I can picture of you two talking is the characters from the, what was it called? The Emotions movie with the was it Disney Pixar? And it had all the emotions, and there was one
Oh,
and
the
two.
in
I
and
can
out
In,
people.
In and
inside
out.
out.
That's all I'm
Yeah.
Inside and out. Yeah,
Inside
that's
Out. There we go. That's
Inside
all
out.
I'm
Yeah.
picturing is these different characters taking control of, the
Hmm.
child's like decisions and reactions, and trying to come to terms with that. But are they hidden?
Great question. Are they hidden? Well, I think intrinsically we have them, right? Because they were part of our survival methods throughout the history of humanity, especially anxiety, right? We know that for a fact. If it weren't for anxiety, we wouldn't be here today as a society. But are they hidden is the answer to that question for me is it depends again. And for me, it is that fact of if you grew up in like this emotionally mature family that where they were, talking about emotions openly, helping kids at young age identify emotions, then they're not as hidden because kids are
Mhm.
more aware of their emotions. And usually when I hear the term hidden, what I think of is they may come out first as like a feeling, a physical sensation, and that's when it's easier to identify, ooh, I'm feeling this. I know it must be anxiety, or maybe it is like I'm feeling sad, right? So they're there. they're just, waiting for something to allow them to show.
So my next question for the two of you, I don't even know how to ask it because I have a hard time understanding it to begin with. So let me tell you what the next question is, and let me tell you where my lack of understanding is, and maybe you guys can, help me with both parts of it. So our next question that we had planned for you guys was, can ignoring certain emotions have long-term consequences on mental and physical health? But can you, this goes, I guess, kind of ties back into the previous question, but can you ignore your emotions? Can you shove them in a box? And put them off and put them off? Is that really such a thing to delay an emotional response? And I don't know, Dr. Rice or Dr. Gonzales, who wants to go first?
I mean, let's just go unless you want to go first, brother. But
I'll piggyback off of you. I have something in mind. Go ahead.
Okay. So one of the things, and especially, and I'm going to go back to talking about how I speak to a lot of veterans and a lot of people who are deployed and things like that, very stressful situations. We have the ability to compartmentalize, right? So it's kind of like we can take something and we can stick it in a box and we can keep it there for a while, right? What happens is that there's only so much room in that box or in that closet or however you want to think about it, right? So if you continue just to think about the closet in your house or something where you throw something in there and then you shut the door, and you throw something else in there and you shut the door, and eventually, it becomes really hard to shut the door, right? Mm-hmm. And so unless you go in and clean that out, unless you deal with what's in that closet, it will come back. Right. And it's not an if, but a when. So go ahead, Dr. Gonzales. I see your face. I'm like, please, it's much more eloquent.
I love
than
this.
I am, so
this is something I talk about all the time. So it's really happy to hear it being spoken about. Growing up in Southeast Louisiana, I had a Meemaw. And, one of the things I always talk about is Meemaw would always invite us over for tea. And, it was like this specific time that we had to talk. So when I would talk about emotions, I always tell individuals, like, if you don't let your emotions be felt, you are stuffing them. And stuffing's only good on Thanksgiving. So you have to invite those emotions in for tea, and sit down and process them. So like I use a 3-word technique that I actually used today in one of my sessions this morning, called the name, claim, and tame. So where you ask yourself, what is the emotion that I'm feeling? You just say, I'm feeling sad. That's the name. What's the claim part? It's okay that I'm feeling sad. But the tame part, which allows it to be a little bit more controllable, I'm going to allow myself to feel sad for 5 minutes, and then I'm going to get back to what I'm doing, right? So you're not stuffing that emotion. Instead, you're allowing yourself to feel it. You're giving it this space. You're inviting it for the tea, and then you're able to kind of transition back to work.
So for those individuals that don't have their tea, they're not addressing it, are there consequences mentally and physically over time or even immediately?
Yeah.
Oh, definitely. There's a study, and I'm sorry, I can't think of it right now, but I read a study not very long ago that shows where, like that anger, like undealt with anger or bitterness, it seemed like, and listen, correlation is not causation. We all know, every great researcher says that, right? But also you have to kind of wonder, right? That I think it was degenerative joint diseases, right? So like arthritis and gout and things like that. And that there seemed to be a higher prevalence in that when there was like this layer of bitterness or unforgiveness or, and I'm not saying that it's going to come back and get you kind of thing, but it's just something else to consider. We talk about the body keeps the score, right? And how we see physiological symptoms even of undealt with emotions.
Yeah, I see it a lot in my population. I work with predominantly males, and that especially down here, right, where it's like this expectation that you're not supposed to show emotions, right? So, I see that firsthand, and it becomes a generational thing as well, because what they're taught from their parents, they then implement within their own household unknowingly, so there are definitely consequences to it. We know stress kills, right? And we know that
Mhm.
in many different ways. So, if you're not dealing with your emotions, especially something like anger that we know is an iceberg emotion, that there's so much underneath that, there's definitely consequences there.
So let's say we're in a very stressful or already in conflict type of environment. How can we identify, I guess, those emotional triggers, for lack of a better way to phrase that, so that way maybe we can improve the way that we responses in those high stress, high conflict areas? And I'm going to pick on Dr. Gonzales first before Dr. Rice's time.
Sure. So when I think of that, I think of Maslow's hierarchy of needs, right? Which, there's these basic things that we have to get to first before we can get to that self-actualization. So for most individuals who are in systems like that, it's survival. That's what it is at that point in time. And until they're able to get those basic needs of, shelter, food, rest, all of those things, it's then that they can figure out the emotional part of it. So, how, when I heard that question was, let's get out of the stressful situation first, and let's reset. And then we're able to process the emotional component to get you back on track mentally.
So then that leads me to, what habits or practices can help somebody improve their responses, or respond to their emotions more thoughtfully versus reactively, Dr. Rice?
So, we talk a lot about mindfulness, and Dr. Gonzalez already brought this up, which is really, and sometimes people think of mindfulness as only being like this meditative kind of process, but it's not. It doesn't have to be just that. Really, we talk about mindfulness, and what we mean is being fully present in something, right? Like just focusing on this one thing, because we live in a society of multitasking, right? Like in the United States today, it's horrible, but we've raised ourselves and we've conditioned ourselves into, and even the like our mindset, our future is based on what's going to happen. I mean, our present is based on what's going to happen, right? So like, even how many times have you heard somebody say, um, like, what are you excited about? Well, in 2 weeks, I'm going on a cruise, or in 3 weeks, I'm going on vacation, or, right? Like, and we do this
Mhm.
countdown thing to the next big thing, right? And the reality is that hasn't happened yet, right? So even our present is based on something that hasn't happened yet, right? So what we're talking about is being in this moment, right? Being at just grounded right here and saying, okay, so what am I really feeling? Right? What is this? Okay. And what is this about? Right? And being okay with it, not judging it and being like, oh, well, I shouldn't feel that way, because so many of us, and Dr. Gonzalez started on this, so many of us grow up in these wonderfully healthy households, he said sarcastically, right? Where we are told, oh, don't feel that way. Oh, you don't need to feel that. You don't, right? And you shouldn't feel this way. And we get should on all over the place by our families of what we shouldn't do. And then we start to think, oh, well, I must be wrong for feeling that way. And so that's the other side of it, is like becoming this non-judgmental part of, wow, man, so I'm really angry. Well, what are you angry about? Well, you shouldn't be angry at them. Well, why not? I mean, right? Or fill in the blank with something else, right? So really just bringing up so much of this into the mindfulness process of saying, hey, this is what we want to do, is we want to acknowledge what it is. And I love his name claim, what was it?
Team, name, claim, team.
Name, claim, tame. Thank you. I think that's such a wonderful way of just looking at it. Is just name, and even it's funny how many people aren't able to name an emotion,
Mm.
right? I mean, and this is not a, we're not being critical. It's just that that's what we were learned. It's what we learned. We were taught this as we were growing up, and then we fell into these systems. Then I go to the army where you don't show any pain, right? Um, and you don't show any weakness, right, and so it's further ingrained into us, and then and we wind up with these dysfunctional behaviors of like, well, I'm not going to let them see me sweat, and really we're doing ourselves a disservice at that point.
Makes sense. Dr. Gonzales, do you have anything to add?
Yeah, I think mindfulness is great. Um, it encompasses so much more than just being like meditative. And to go off of like what Dr. Rice was just saying, with individuals who don't really know words for emotions, we have tools now. So like the feelings wheel or emotions wheel, which is a whole entire graph filled with words that describe emotions. And I always tell my clients, start off in the middle with the basic ones that which are like sadness, anger, fear, and I said, and then branch off from there and see if you can be more specific, so mindfulness is so much more than just meditation. When I work with teens or kids and we're trying to accomplish mindfulness, I always start with eating, and I always ask them, like, when you eat that Oreo, for example, how many bites does it take you before you swallow, and then ask them to extend it, so to be more mindful. And our body's connected. Everything within our bodies is connected. So even with something as simple as eating an Oreo, you're bringing your attention to that thing, and that could then transfer over to, why am I feeling this way? Is it because I'm angry or sad? So, mindfulness is a great component that can be done in so many different ways.
I guess my last question for you, which I think is pretty important, as we have been talking about mental health awareness, and you even started out by talking about Dr. Gonzales talking about, even having the emotions, knowing that it's okay to have them. When do emotions get to, I guess, that unhealthy point when they do need to seek, a professional like one of you guys for additional assistance? How can we identify where the struggle is beyond just something working through on your own? And I don't know who wants to go first, Dr. Gonzales, Dr. Rice, but how do we identify that moment when we need to ask for help?
Yeah, I would say that when you feel like you have no more coping skills left to deal with them, right? So if you tried the deep breathing, if you tried, all the different things that you know of, one of the big trends that I'm seeing is like individuals are now going to like mental health TikTok or something like that, to where, they're seeing these coping skills before they go to therapy, which there's pros and cons to that. But, as what I always say is like, if you're feeling so angry or if you're feeling so anxious that you feel like it's crippling, I can't get out of bed, I can't focus at work, all of the different, my relationships are struggling, that's usually your sign that you need to seek professional help to help process those things and give you coping skills that are the best for your situation.
And Dr. Rice, last question before we let you guys go. Do you have any other tips or suggestions for the audience about asking for help or encouraging them how to speak to a loved one to ask for help?
Unfortunately, we still carry some stigma and we are better than we were. Okay, that is a fair statement, is we are much better than we were. However, as a field, there's still a lot of stigma around mental health. And it really is a matter of, be brave, right? Be brave enough to say, I'm not sure, right? And to also remember that, asking for help in something like this is not, I often look at it much like a coach. If you look at like the Olympics, right? We came off of the Olympics. Um, arguably the best athletes in the world, right? But what they have is they have an extra set of eyes, an extra person looking over their shoulder saying, hey, try this, try that, right? Like these are ways that you can improve and make sure that you're right. And so maybe even if they start to think about it in that term of, this is not, going to therapy, going to counseling doesn't make you, as I hate to say it, crazy, but that seems to sometimes be what follows. But it's really sometimes about saying, let me get a little more perspective on something from an expert who maybe knows a few things and can tell me, hey, keep your back straight, point your toes. If I go back to the coaching thing for just a minute, right? Even following along in that line. So, but it's really about being brave enough to ask for help.
This has been very insightful. I want to thank you both so much for taking time out of your schedule. Like our guests from the clinical mental health program last week, you guys are much like them in the sense that not only are you teaching, but you're also still practitioners in your field. So we really appreciate you guys taking the time to help us work towards destigmatizing, mental health and open those conversations. So thank you very much. And most importantly, Dr. Rice, thank you for your service.
Thanks.
And if you guys have enjoyed this conversation, be sure to like, share, subscribe, and follow, and we'll catch you on the next one.
Thank you for journeying with us today on Keiser Voices, the story of success. As we close this chapter, remember, every story has its next page.